1 in every 7 people has some form of disability. 1 in every 11 people aged over 65 years or more, and almost half of them are elderly with disabilities. Evaluation study of the Hygiene Behavior Change Coalition (HBCC) for COVID-19 prevention. The inclusion of people with disabilities, older people with disabilities in Indonesia, 2021 and 2022. The Center for Islamic Study Universitas Nasional was conducting an evaluation study for HBCC program or Hygiene Behavior Change Coalition in Indonesia. This study was a collaboration with International Center di Real Disease Research Bangladesh and supported by the PENDA or Program for Evidence to Inform Disability Action. PENDA is an international consortium working on creating evidence to improve the well-being and inclusion of people with disabilities in developing countries. The Hygiene Behavior Change Coalition or HBCC was a program launched by the UK government and Unilever in March 2020 to prevent the spread of COVID-19 in 37 countries around the world. In Indonesia, the HBCC program was implemented by a number of organizations such as SNV, GIZ, UNICEF ActionAid, and Save the Children.
Halo teman-teman, aku mau kasih tahu gimana caranya cuci tangan yang benar. Pastikan ada sabun dan air yang mengalir ya.
Pertama, in this study, we evaluate the HBCC interventions delivered by Save the Children, which works in 20 schools in North Jakarta, province of Jakarta, and 20 schools in West Bandung, province of West Java. Site selections. Study sites were selected randomly by identifying villages around the HBCC schools. There are 6 urban villages selected in North Jakarta, representing the urban area, and 6 villages in West Bandung district to represent the character of the rural areas. Participatory study design. To initiate the study, we conducted a study design workshop with stakeholders, the representatives of government agencies, implementing agencies for HBCC programs, organizations of people with disabilities, and universities, where the relevant stakeholders we invited to get the feedbacks for the study design. Training for enumerators. Before collecting data in the field, we provided a 3-day online training for enumerators related to study designs and objectives, research ethics, methodology, the use of digital applications for collecting data, and the use of Washington Group, a tool designed to identify the impairments and disabilities with objectivity and reduce stigma.
So they have different handwriting systems.
The survey was carried out by asking a number of questions related to the knowledge, attitudes, and behavior of respondents regarding COVID-19, program intervention, media, and hygiene behaviors, such as washing hands with soap, wearing masks, and social distancing.
Sekarang besok. Oh, udah juga semua. Yang kedua ada siapa betul? Yang kedua anak ya.
We also conducted a spot check to see the access and conditions of water and sanitation facilities at the household, community, and schools.
Stroke terus apa nih dibikin kursi kayak iya itu abang sih yang bikin. Oh abang yang bikin iya. Jadi Mbak Bunga sendirian ngurus bapak.
Harap juga ini jadi banyaknya di sini gitu.
Key informant interview. To have a wider understanding of the HBCC program and the inclusion of people with disabilities and elderly during the pandemic COVID-19, we conducted interviews with government representatives, Save the Children, Indonesia, managers and staff, teachers, and representatives of organizations of people with disabilities. In-depth interviews. To understand about the situations of people with disabilities and older people during the pandemic and how the HBCC interventions were delivered, we conducted interviews with students with disabilities, older people, community leaders and members, teachers and caregivers. Photo voice. We also conducted a photo voice ranking, a method to collect the data by taking photos according to the respondent's point of view, regarding 5 things of challenges and 5 things of happiness they had during the COVID-19 pandemic. The study shows people with disabilities and the elderly are the most vulnerable groups to be infected by COVID-19 virus due to their impairments and difficulties. Family members, neighbors, health professionals, and carers are the most important figures to support the people with disabilities and older people. Television has become the most effective medium in disseminating messages about COVID-19, as well as to raise awareness hygiene behavior for the prevention of COVID-19. Organizations of disability groups and educators from schools for special needs have a very strategic role in raising awareness of the rights of people with disabilities and advocating more inclusive policies in handling during the COVID-19 pandemic. We hope by conducting the study, we will raise our awareness about the same rights and well-being of people living with disability as the same rights with people without disabilities, as stated in the Law of the Republic of Indonesia, number 19 of 2011, concerning ratification of the Convention on the Rights of Persons with Disabilities. Every person with disability must be free from torture or other cruel, unhuman, or degrading treatment, free from exploitations, violence, and arbitrary treatment, and has the right to have respect for his or her mental and physical integrity on an equal basis with others. This includes the right to obtain protections and social services in the context of independence, as well as in emergency.